gastroenterologists and hepatologists are not trained and have no clue. So, what are some of the domains which have been validated for assessment in patients with liver diseases specifically? All of you are experts in this, so I need not go into what is available tools, but what is validated in liver disease are one, severity of the ED, the scores that all of you know, but what is most widely validated is the International Index of Erectile Function. The SEPI, the GAQ, and the quantitative adult questionnaire are the other ones which are validated. For females, the six FSFI score, six domain FSFI score, the desire, arousal, lubrication, orgasm, satisfaction, and pain domain, and the overall score below 26.55 is indicative of female sexual dysfunction. And of course, you have the other methods of assessment which are validated in liver diseases, like the Golomb-Rust inventory of sexual satisfaction, the brief index of sexual functioning for women, changes in sexual functioning questionnaire, the Derodatus interview for sexual functioning, and the female sexual function index, FSFI. So, so the first step in the management of sexual dysfunction in both the genders in liver diseases is assess the severity of the liver disease and treat the root cause of the liver disease. That is the single most important intervention which can be done because that addresses almost 70% of the problems that are there. If you leave the primary problem, no matter what you give to the patient, your problem is not going to get solved. So, of course, we have to take news questions, we have to take a detailed targeted history, a careful pelvic examination, ask for the relevant investigations related to the liver disease. So, typically, you would ask for a CBC, LFT, RFT, INR, hepatitis B, HbSAg, NT-HCV. So, these are the bare minimum tests that should be done in anybody who is suspected to have a liver disease. And then, of course, you will treat the root cause of the sexual dysfunction. These patients require huge support. The sexual dysfunction, but for their primary liver disease also. Today, almost all liver diseases, irrespective of their etiology, have a treatment option. And in majority of the cases, even in the presence of cirrhosis, you can actually treat the etiology and you can actually reverse cirrhosis. So the old concept that we had, that cirrhosis is irreversible, is no longer valid. Today, even in cirrhosis, with treatment, you can reverse cirrhosis in a proportion of patients. And that is the key. So, what about specific treatment? So, of course, we do primary liver disease treatment, counseling, I think environmental modifications. I just heard a wonderful talk on the use of robot and AI. I think very exciting times for the future. Specifically, for erectile dysfunction in men, we have to be very careful when we use PDE5 inhibitors. The first thing is they are contraindicated if the patient is CTPC. So patients with decompensated cirrhosis, we cannot use PDE5 inhibitors. Patients with CTPB, we have to be very careful. Why? Because these patients inherently have a low blood pressure. Their diastolic blood pressure is 60, 65, 50. And if we get these PDE5 inhibitors, very often they will have precipitous hypotension, their renal perfusion reduces, and that can cause acute kidney injury, and the creatinine can go up, and patient can even get syncopal attack. So be very careful about prescribing PDE5 inhibitors in patients with CTP A or B. If at all you are using PDE5 in patients with advanced liver diseases, do not cross 25 milligrams of sildenafil or 10 milligrams of tadalafil. And vardenafil, of course, there's limited data, but with evenafil, there is absolutely no data. For females, it is even more difficult to manage. So, what works for anovulation and amenorrhea is, unless you treat the root liver disease, it is not going to come back. So, you can limit the menstruation by giving OC pills and withdrawal therapy, but it does not really start the ovulation. Reduce libido, Basically, all you can do is treat the depression and give psychosexual support. But again, you have to treat the primary liver disease. For inability to orgasm, of course, your usual therapies will work. Some programs. Now, coming to what are the effects of these HEP changes with the use of PD inhibitors? So, HEPG is the portal pressure which we maintain in patients with cirrhosis. So, if the patients get PD5 inhibitors with tadalafil and sildenafil, the studies have shown it does not reduce the portal pressure. But with the newer PD5 inhibitors, you actually get lowering of the portal pressure. So there is a possibility of therapeutic potential of PD5 in patients with advanced portal hypertension, but again, the jury is still out. So quickly coming to our work, this was a paper which actually won the ASCP award. So this was gonadal dysfunction in male patients with Budd-Chiari syndrome and its reversibility with treatment. Budd-Chiari syndrome is endemic in our part of the country, in Western India, and we have a series of more than 1,000 patients of Budd-Chiari syndrome. Now with treatment, the survival is now. So we have now moved on to the quality of life issues. So Budd-Chiari syndrome is thrombosis of the hepatic vein, which is blockage of veins between the liver and the heart. So we demonstrated in 16 patients that almost half of them who were sexually active had actually erectile dysfunction, and the most common pattern was hypogonadotrophic hypogonadism. So it was central in nature. Another one for had hypergonadotrophic hypogonadism. Once we treated these patients, and almost 94% patients had actually their erectile dysfunction improved after you treat it. So if you treat the root cause, you improve the erectile dysfunction, but if the hypergonadotrophic hypogonadism is persistent, then complicated. Last slide, please. So VCS causes primary infertility, and if you successfully treat the Budd-Chiari syndrome, the infertility improves, the patients can successfully conceive and then deliver. So to summarize, my dear friends, gonadal dysfunction is common in all stages of chronic liver disease in both genders, but keeps on progressing as the liver progresses. Metabolism disruption is the major mechanism, but several other mechanisms coexist. Several etiologies have their own mechanism of contributing to the sexual dysfunction. A structured and detailed analysis is needed to evaluate the sexual dysfunction and its cause in patients with liver disease. Many sexual dysfunctions can be evaluated and treated by appropriately treating the primary liver disease. These are very well documented in Budd-Chiari syndrome. The PD5 inhibitors have to be used with caution, especially in advanced liver diseases. And treatment of the underlying liver disease is the cornerstone of therapy for this sexual dysfunction. Thank you very much.
Thank you, sir, for your interesting and lucid presentation. When sex word comes, the another word becomes there, alcohol. So people will enjoy while giving their questions. Thanks for the nice presentation. Would like to invite Dr. Smita Shakla, a highly accomplished ENT surgeon and a renowned expert in allergy disorder. Dr. Shukla is the founder and director of Mumbai Allergy Center and currently serves as the head of department of allergy science at Sir H.N. Reliance Hospital. Additionally, she is an honorary consultant allergist at Esteem King Hospital. Dr. Shukla has award including Dr. Gold Medal Award, Dr. V. Raju Award for the Best Research Paper, and recognition as the Best Scientific Researcher by the Prime Minister Office of India in 2006. Welcome, ma'am.
Good morning, everyone. Thank you, Dr. Mutha, our dear friend, Dr. Sakle, Dr. Nath, and the whole organizing team to give us this opportunity. This is the first time attending this conference, and I must say the topics are fabulous. And it's an eye opener for the doctor also. So, let me talk about the association of sex and allergy. And this presentation itself gives us so much of insight in this part of my subject. So let us talk. Can a kiss cause death to someone with allergy? Answer is yes. This is about a girl called Madhu, 20-year-old, and in 2012, her boyfriend had given her sandwich for lunch. In the evening, they kissed, and she died because of anaphylaxis. This girl had a severe peanut allergy before. Unfortunately, she was partying and she did not have her adrenaline or EpiPen, and there was transmission of peanut through the boyfriend's saliva, causing anaphylaxis and death. So after that, people realized that yes, during such acts, a person with food allergy can also die and can have reactions. And that is how a lot of new laws were made in the US regarding the food allergies. And there is a book also about how to kiss and have sex if a person has any food allergies. So nowadays, when we were residents or doing our things, there were very less amount of allergies. Now allergies have increased. Initially, it was the disease of the rich and the western area, but now we Indians also have it. And the most common reason is that we are becoming more western nowadays in terms of our habit and eat food, the way we live and the way we eat. So we are trying to now say that instead of we becoming westernized, let us easternize the western world. Because when we present any good data from India, we see that Indians, because of our old culture, of making food and many other lifestyle things which we were following as Indians, we were protected from allergies. So let us go back to that. And the tagline which we say for any conference is let us easternize the Western world now. So all these allergies have increased. As I said, allergy is basically a systemic disease. You can have any presentation. It can be allergy fine, urticaria, food allergy. But today we are talking about sex allergy. So we all know the benefits of sex. This is a esteemed audience. I will not say that emotional and the physical aspect. Yes, if there is any issue in the physical intimacy, the quality of life is affected. And recently, this is 2020, a very good research was done for respiratory allergy, and it was found that if someone had allergic asthma, the quality of sex life was as bad as 48%. With allergic rhinitis, it was 40%. Whereas for control, it was only 20%. So there are many index to assess the quality of life. I'm not going into the detail. You are an expert in this. There is an association of allergic disease with sexual dysfunction. Most of the time, any allergy will actually cause a systemic inflammation. This inflammation will cause changes in the hormones, and especially female, this will cause decreased arousability and sexual dysfunction, whereas in the male, it will decrease further. Testosterone can cause autonomic dysfunction, leading to erectile dysfunction. There are many allergens in the genitourinary tract. In vagina itself, a person can have house dust mite, food related sperm and fungus. Whereas in a male, the prepuce of the penis is the problem where you can have lots of, food particles, latex, semen, fungus, even topical medication, soap, detergent, textile dye of the undergarment, all these things can accumulate there. And all of them will eventually cause a lot of recurrent microscopic inflammation, finally leading to allergies. So the best way to reduce the skin allergy is the skin and this is the association. Where you put the extract in the skin and do a basics of acupuncture with the needle. It's a interest and it's better being a clear reaction. I think this is one of the best part of treatment. This is the era of technology and smart technology. Everyone wants things. I just think it's anything to be. And the best is so counseling becomes very easy. This technique gives me therapy primarily and the most important challenge is about that. When I'm having physical relation with my boyfriend, so this is also called as any of the gender and issue in the nose, which is stimulated. This is a serious study which said that almost 30% of asthmatic patients have hormones in body because of asthmatic cancer. Ejaculation happens, there can be deep burning and high exhaustion. Please simply test. And the treatment is to avoid any illness products. Most of the time, these patients can have without allergy also. And whenever they are using liquids. This is very common in patients who undergo multiple procedures in the hospital because the latest exposure is so much. So, in such patients, we always take a extended history to do another amount of latex allergy. So, in such case, a polyurethane condom can be very easily used. Many of the contact dermatitis of the genital areas can be solved with condoms, injections,
within a bit.
lots of bubble baths and center baths and so on. So this is a diagnostic approach. The people in the patient have any other allergies, we will for secondary allergy, people saying we can do a basket when it comes to some new observations in literature. This is not very interesting. But sensitive like Brazil, like you are there, and this is reactor. So condom and semen energy was ruled out, and it was completely concluded that this patient, he had a Brazil and this Brazil was secreted into the semen and from the semen into the female and the resources got a reaction. This is a recent article. New researchers talk about the association of allergies between fertility and IVF. This is a recent August 20 to 20. Last year, where we say some of the people who had a unexplained infertility and two, she had history of allergy. The seminal plasma allergy was detected. She also had and that's why and then for infertility and then IVF. So the answer could be yes. Now this is a food for thought for many of allergy specialists. And here the treatment again becomes a barrier contraception, antihistaminic, sperm desensitization, and so on. One more patient we talks about high allergy in patient undergoing IVF and embryo transfer. A root cause of new infertility and sex issues is the pollution. This pollution and the pollutants in the air cause lot of oxidative stress in the body and damage to the hormones and leading to sexual dysfunction. So this is something like we should try to avoid pollution as much as possible. My take home message is allergies do impact sexual functions. They can trigger respiratory allergies. Food and drug allergy the allergens can be transmitted through saliva and semen. Contact dermatitis is very common. HSP can be ruled out. Please refer your patients if you and think this is some of the allergies to an allergy specialist to diagnose and then treat the patient accordingly. I am an ENT surgeon. I started my practice with the allergic rhinitis, but then as I was breathing and all, I now treat multiple allergen syndrome. Allergy is a Pandora box which can have allergic rhinitis, asthma, food allergy, skin allergy, drug allergy, vaccine allergy, and now sex allergy. So my disclaimer at the end of the talk, I treat all type of allergy except spouse allergy. Organ controlling any class. Thank you for
Thank you ma'am, for very deep insight on the rarely discussed topic. Thank you, ma'am. For the next topic, that is for orbit session, I call upon the stage Dr. Sanjay. He is having 30 years experience in practice of skin and sex genital medicine. On 84 varied topics, he has been talked in multiple organizations, public forums, and as well as OTTs. He is clinical observership at UK, USA, as well as South Korea. Sexology podcast on Storytel. You might visit to Storytel. It's really interesting when you can listen to the he is corporate psychology, HR sexuality trainer in multinational blue chip companies and MBA schools, more than 100. He has been authorized 3 books on sexology with legal copyrights. He is fascinated for University Grant Commission on mind sex academics and more than sex educator, therapist, counselor, expert, and on YouTube as well as BBC. So, time is for viewers. So sorry, sir. Sequence is changed.
Yeah, so this is a very interesting topic that we are again coming to. And we roam east to west with Dr. TSS sir to see the epidemiology of female sexual dysfunctions, female sexual dysfunctions. But now we will turn to a topic which is very universally becoming problematic. It's rapid enticing and influencing or the people of all age groups. So what is this? Actual instinct. We are very interested when a man and a woman are in sexual congress. And in some way or the other, even if we say no in public, we definitely, a human being is inclined towards viewing all this. A sexual congress between a man and woman has always had a dual position, unique position in society. While some it is regarded as natural, biological, and even as we see sculptures and paintings in our old Indian culture, while is regarded as taboo and sin. But the visual pleasures that we see in Kama Sutra, even we admire the images of Radha and Krishna making love. We feel tickled by what we see in Tollywood and Bollywood. But at the same time, when we look at the sculptures in Khajuraho and Konar, we do have a little bit of feeling of doubt whether we are doing the right thing or a wrong thing, whether this is immoral or moral. And this is the topic of our debate today, that pornography, how far is it essential? Is it educated for our young generation as it was in the previous centuries where it was taken as natural and educated? But nowadays, this pornography is being shown as starkly naked and very mechanical. So the artistic display of human relations is lost. Sensuousness is lost into technicalities. And now we will see by our two esteemed speakers that the pornography is actually helpful to us, helpful to layman, helpful to us as therapists, helpful to our patients. Should anybody indulge into it? Or it is going to accidentally cause certain brain changes and take us on the addiction path, and therefore it should be totally avoided. So I request all of you to please listen attentively, and we are taking a referendum at the end of the debate. Thank you. Dr. Deepak Lokande.
Thank you. Is my audible? Okay. So we tried to think about this in a different way. We thought first I will go ahead and speak about the ill effects of pornography, and my esteemed colleague will then come up and speak for the benefits. I think there are benefits which were an eye opener for me. So I would want to listen to what he has to say, but in a sense, what I'm going to be sharing with you is about what are the challenges or what are the ill effects of pornography. So, thank you. So my topic will be in these sections. We talk about soft porn, hard porn,
physical impact upon, psychological impact upon, and social impact upon. So this is where we will have our discussions today. What is porn? Anybody? It is taking up the most intimate, private activity which is normal, natural, and then making it visual. Somebody captures it on a visual media and then tries to make money out of it. So that way, porn is something of a voyeuristic activity for other people's benefit, where they look at what is happening in action and then probably also indulge in it in their own ways to satisfy their urges. Madam was talking about Khajuraho and centuries old of tradition. I will just take you to the last century. Does anybody remember these campaigns? Yeah? The first one, Mr. Milind Soman and Ms. Madhu Sapre, the ad is for shoes. Can you see the shoes? No. Yeah. So these are big hoardings across Mumbai. I was going up. And there's a snake there, and that was called as aesthetically creative. The next one is about an undergarment. And can you identify the actors there? Come on, the crowds. Vipasha Basu and Nino Moria. In the first one, we have Madhu Sapre and Milind Soman. And the last one, it's for, by the way, the last one, which is for Emma Coffee. And the tagline is real pleasure can't come in an instant, right? Do you know who these guys are? Do you know Munni Badna Huli, the lady who sang that song or danced to it? Yes. Mrs. Khan and Mr. Khan. Arbaz Khan and Mrs. Arbaz Khan. So, this is where, in the last century, there was propagation on porn, or soft porn as it's called. Now let's look at what's happening on YouTube. Look at the words, look at the expressions, and tell me what you see. Surya mistakes, messaging, the body language, clothing was conveying a different message. And what was talk of poetry guys different. This was in the last century, as I said. Now let's look at what's happening today. Sure. The messaging, the works, and what happens next. When we look at of it can be classified into two parts. One being soft porn and the other being hard porn. Soft porn depicts my nudity, which you saw in the earlier reel, and then messaging in the other one, right? So it depicts my nudity. Explicit sexual content is less and often found in films, advertisements, and magazines. hardcore porn